Hey, what's up? Dr. Chad with Energy Physio. We're tackling some low back pain here, and it's pretty common for muscles in the low back to actually generate a lot of pain. So putting some input and some pressure there can loosen things up and help relieve a lot of pain in the low back area. We're gonna use the Alpha Ball. There's a lot of bony edges. We've got the ribs coming down. We've got all the little projections off the spine. We've also got the top of the hip. This is called the ala, and it's this big fan-shaped bone that's the top of the pelvis. And so we like the Alpha Ball because it's soft enough to get on those bony edges, but firm enough to press into some stiff tissue, help you get some work done. So the target area here when you're laying on your back is actually right along these areas just alongside the spine. So if this is the spine, we don't want to roll directly on it. We want to be in the soft stuff just off to the side. And you're just gonna roll over on there and take some pressure. We don't have to do a lot of moving around here. If we can just settle into the pressure there. If the pressure's too much, you can actually raise your hips off the floor a bit and control how much pressure you actually sink down into the ball. This is also a nice way to engage the muscles a little bit as you work up and down, and then raising the hips off the floor allows you to move side to side on those tender muscles and start to work some of that pain out of there. And the side to side is also important because the muscles run long ways, and so moving side to side actually goes across the muscle fibers and is actually much more effective at decreasing some of that stiffness in the lower back. But remember, we don't want to roll on the spine directly. We don't want to get too far up into the ribs. And if it feels like you're pressing on a bone and it's uncomfortable, you're probably pressing on a bone. So shift it around until it feels like it's just in some uncomfortable soft tissue. Work there for 2 to 3 minutes. You should have less pain when you're done. See you later.